My dad was a physician, and I just always remember wanting to do what he did. I thought it was really great. I grew up in Maryland and then moved to Florida with my family and went to University of Florida for undergrad and University of South Florida in Tampa for medical school and residency. And then I moved to Texas and practiced there for 5 years, and then followed my husband in the Air Force to here, and now I've been here for 12 years. And I just really found that I liked taking care of women as patients better. No offense to any men out there, but women tend to, be the caregivers for their family more, and they take better care of themselves. So I really liked that we worked as a team, the women, and, we would tell them what to do and they would actually do it. And so they also tend to be a healthier patient population overall. I do participate in residency training, so we have family medicine residents that come through. So we teach them gynecology, and then I do take on a medical student a couple times a year for a month to mentor them and do their gynecology training as well. I really think everybody's an individual. I don't like to follow algorithms or just treat everybody the same. So I feel like listening to the patient and seeing what's important to them really helps me decide what I would recommend for them, but really just having a conversation with them and giving them choices and making sure that they're participating in their care and it's not just a one-way street. I think now that I've been here for 12 years, I really enjoy just seeing my patients through the years. I've had, some patients that have started with me in their teenage years, and then I've been with them for so long, they've had 2 or 3 children now, and it's just really great to know them as people and see how they develop and where their life brings them. So I think just knowing them for a long time and playing a part in these different parts of their life. With hysterectomies, most of the time, now they're done minimally invasive most of the time, which is great. So most of the time that'll involve 3 or 4 incisions, especially if you're using the robot platform. So since 2009, I've been doing it with just 1 incision. That's only about a centimeter in the belly button. So it's a hidden incision, but the same surgery. So there's no other gynecologists in Dayton that are doing that right now. I found that the patients had a lot less pain because you're going through a anatomic defect in the umbilicus or belly button, and so they had a lot easier recovery time than with the multiple incisions. And again, the hidden incision was something that they really enjoyed. I used to be a proctor for the company that started the procedure, so I would have people coming in to watch me do the procedure, and I would train them in that as well. As far as benefits over the robotics, it again just less incisions, less pain, same complication rate. Recovery time is pretty similar between robotics and the single port, but cost-wise, it is also a cheaper procedure not involving the robot. Well, we have very diverse physicians in our group. We make sure that the patients, especially in the surgical realm, are taken care of by the best physician for what they have. So, we have the urogynecology program, so we have urogynecologists who will take care of that aspect. We have people who are expert trained in robotics, and then, I do single incision surgery for patients who have less large uteruses, and that way there's less pain and better cosmetic outcome. So just being able in our group to refer each patient to where they would be better served to physicians who do something a lot instead of people who do a little bit of everything. So I think because we have these subspecialties in the group, that helps. So we have several different locations. We have locations in Inglewood, Heber Heights, Beaver Creek, Springboro, and Centerville. We have physicians in all of those locations, and so by opening that up, we have a lot of different offices people can go to. And then we deliver both at Miami Valley South Hospital and Miami Valley Main Campus, so different options for hospital deliveries. We tend to take time with the patients, so some practices will be delivering babies and also going to the office, running back and forth, kind of a rushed feeling. We make sure whoever's on call is just on call, so when you're in the office, you have that time to just give to the patient, not being in a hurry, and then again just individualizing their care for them and having them participate in what they want to do.